seperti yang diumumkan oleh Yang Amat Berhormat Perdana Menteri bahawa kita akan memberi kelonggaran.
We thought the worst was over, that finally the dreaded scourge was defeated. Our stalwart defenders in Hospital Sungai Buloh, pulled from all over Malaysia, were allowed to return to their homes and given some respite. A glimpse of normalcy was finally afforded to the frontliners of Hospital Sungai Buloh. With many sectors reopening and people being allowed to travel interstate to see their loved ones. However, this was but a lull in the storm. Sparked by the interstate travelling, a chain reaction of new COVID-19 cases exploded across the nation.
Nur Hisham said the increases in cases, which came following the Hari Raya festivities, also saw a rise in the number of people admitted to public hospitals and COVID-19 quarantine centres. The number of those admitted to these public health facilities increased by 38% per population of 100,000 compared to the preceding week.
The healthcare workers of Hospital Sungai Buloh braced for the impact and dug in their heels. Men, women, children, young, old, rich or poor, none was spared from the ravages of the invisible enemy. From cradle to grave, Hospital Sungai Buloh took care of everyone who sought succor from the COVID-19 menace.
The peak of the Delta wave pandemic was a moment which was totally unprecedented. It was an event that none of us had a playbook for. There was no point of reference. Optimizing the resource of space and availability. We open up areas where otherwise we would have not kept patients, but those areas which have oxygen pods, nevertheless, were opened up to makeshift wards. And this was the way we could accumulate or accommodate such a high number of cases in one simple center, hospital, or even a department. Across all specialties, including administrative, clinical, non-clinical, allieds, and that teamwork managed to get us through that finishing line. Many of the times we were faced on perhaps frequently on a daily basis were to make very sensitive and difficult decisions. Decisions that no one of us ever would want to have to be in a position to make. Nevertheless, that is the job. It was made much easier where such decisions were made cumulatively in a group of specialists and consultants.
Engineering team worked so hard day and night to ensure the staff had appropriate facility to treat patients. Some our staff that could not go back home to see their family because we all facilitate all the system and facility to make sure patient and staff had their accommodate facilities. VIE medical gas, which stand for vacuum insulated evaporator, was installed at Hospital Sungai Buloh and PKKM. The capacity of existing VIE at HSGB is about 11,000 litres, but we install another 20,000 litres. The main purpose of a new installation of VIE tank to ensure the oxygen supply is always sufficient for the patient during that time.
The engineering department of Hospital Sungai Buloh worked tirelessly behind the scenes to ensure our healthcare workers had the foundational infrastructure to provide the very best of care to our ailing nation.
During the peak of the COVID pandemic, we were having tens of thousands of infections in a day, including pregnant mothers. We know that pregnant mothers infected with COVID, especially with the Delta variant, have more serious illness and complications. Henceforth, our department's protocol at that time was to admit all pregnant patients who are COVID positive for close observation and treatment. Despite the tsunami of cases we were getting at that time, all hands were on deck to maintain a higher standard. Every pregnant mother who was admitted to our ward will be counselled together with their partner that if their condition deteriorates and their oxygenation is poor, they would require admission to the intensive care unit. What is worse is that after the delivery, mothers could not even hold their babies as they had to be separated to prevent transmission to the baby because they were often premature with weaker immunity to fight the COVID infection. The earliest we had to deliver a mother was when she was pregnant at 5 months, and sadly the baby did not survive. We also had a few cases whereby mothers succumbed despite all our efforts to save them. During the 2 years of the COVID pandemic, we had a total of 19 pregnant mothers dying from COVID-19 in our hospital. Although our hospital had a low mortality rate comparable to hospitals in developed countries, this was a scant consolation when we had to face dying previously healthy young mothers. We tried our best to help grieving families by ensuring they had access to the hospital's psychological support services, as well as NGOs that provided similar services. Fortunately, the severity of COVID infection in pregnant mothers started reducing when the Ministry of Health started advocating for the COVID-19 vaccination for all pregnant and breastfeeding mothers. The numbers have shown us how effective the vaccination is, and even now, my colleagues and I make it a habit to check the vaccination status of every patient we see, whether they are planning to conceive or is already pregnant. Now, there are less than 5 COVID-positive pregnant patients in the ward, a victory sign that Malaysia has entered the endemic phase. I would just like to shout out to all the mothers who had to go through their pregnancy and delivery during the COVID pandemic, going for appointments alone, worrying about possibly getting infected, as well as going through childbirth without their partners. All of you are the definition of strength and resilience, and it always amazes me what a mother would do to protect a baby.
We saw a surge of admission of pediatric cases that was admitted from the community that was contacted with COVID-19. However, at the same time, there are also several mothers who get infected with severe COVID, and some of them that needed early cesarean section to save their life. And hence, there is also increase in this premature baby that was admitted to our neonatal ICU. Unfortunately, there are some mothers that couldn't make it. Thankfully, with the help of our medical social welfare team, they are able to assist us to find a suitable caretaker and relative to take care of all these unfortunate babies. In the neonatal ICU, we provide the best care for all these babies. If the mother wish to give breast milk for the baby, we encourage them to express their breast milk. However, a simple task as milk preparation has become a big task for all the staff in neonatal ICU with the increased loads of all these premature baby.
During the era of this pandemic of COVID-19, forensic medicine department actually faced a challenge which are increase in the number of body that we have to actually handle. And due to limited number of staff, it also tolls on our staff to actually how to handle all this body. However, we have a very good support from the Ministry of Health itself and Hospital Sungai Buloh higher management, whereby we have been provided with body containers to actually support us with an increasing number of bodies that we are facing. And we also got help from the NGOs. For example, we have increase in the number of body trolleys that we need, and they have been supporting us with this. As there is improvement in the rates of the vaccination, so we can see there is reduction in the number of deaths.
The COVID-19 vaccine was a godsend, precipitously reducing the severity of COVID-19 in patients. Each vaccine dose was a nail in the coffin for the COVID-19 pandemic. Vaccinated patients, by and large, experienced mild symptoms and were able to recover from the disease in the comfort of their own homes. By 31st August 2021, Merdeka Day, the number of COVID-19 patients requiring hospitalization were already steadily decreasing. This significantly reduced the healthcare burden on the nation's hospitals, and no one felt it more keenly than the healthcare warriors of Hospital Sungai Buloh. With the extremely reduced numbers of COVID-19 patients requiring hospitalization, Hospital Sungai Buloh is currently in the process of going back to business as usual. Healthcare workers, previously requisitioned from other departments for the COVID-19 battle, have returned to their respective units.
Statement of intent ataupun kenyataan niat kita pada tahun ini adalah pada tahun 2022 COVID menjadi endemik. Maksudnya kita harap bahawa pandemic phase of COVID dapat kita tamatkan dan dapat kita melangkaui ke zaman endemik.
The nation is currently in the process of transitioning to treating COVID-19 as an endemic disease. Thanks to the efforts of all Malaysians, we have won the fight against the COVID-19 pandemic. Now, for the first time since the advent of the COVID-19 pandemic, we can all enjoy a breath of fresh air.
I am Dr. Kuldeep, the outgoing hospital director, Hospital Sungai Buloh. It has been my pleasure. It has been a privilege and honor to have served Hospital Sungai Buloh throughout the entire COVID-19 journey. I would like to express my gratitude to all the frontliners, unsung heroes, selfless volunteers, and to all Malaysians that have contributed to combating the COVID-19 pandemic. We could not have fought this pandemic alone. We could only do this together. Thank you, thank you, thank you to all of you.